Magandang araw po sa ating lahat. Nagbabalik po tayo sa ating rationalization and questions na possible na lalabas sa board exam, and what we're going to talk this time is all about common questions in psychiatric nursing. Mahaba-habang usapan to guys, and pwede po kayong magtimpla ng kape dyan para still awake and alert ang ating mga neurons sa ating rationalization. Okay? So without further ado, let's start. Number 1. Which assessment is most important when evaluating signs and symptoms of mental illness? A. The intensity of an emotional reaction. B. The client's social and cultural norms. Letter C. The inability to face problems within one's life. And letter D. The decreased amount of creativity a client exhibits. Ang sagot po natin dito is letter B. Kapag nag-a-assess ng signs and symptoms of mental illness, it is important to evaluate the social and cultural norms. The context of cultural norms determines if behaviors are considered acceptable or aberrant. Kasi pag nag-assess ka ng patient and you observe na may ginagawa siyang kakaiba, hindi naman ganon sa culture nila, it means there is something wrong. Kaya it is important to evaluate the social and cultural norms. Ang sagot po natin dito is letter B. Number 2. Mrs. Philomena has been diagnosed with atherosclerosis. History shows non-compliance to the medications and diet prescribed. Mrs. Philomena added, "There's no need to do those things. I feel fine." You understand that her behavior is A. Adaptive because she is able to verbalize her thoughts and insights to the nurse. B. Realistic because she recognizes the limitations of her abilities. Letter C. Maladaptive because she refuses to accept the gravity of her problem. And letter D. Abnormal because she is manifesting disturbances in thought process. Our answer here is letter C. Sabi niya, there's no need to do those things. I feel fine. Dito, in denial na yung patient, which is already maladaptive in nature because it already affects her health and she is unable to meet demands of day-to-day life. Again, our answer here is letter C. Maladaptive because she refuses to accept the gravity of her problem. Okay, number 3. In which client situation is ego development evident? A. A client calls out in pain to get his or her needs met. B. A client complains of poor self-esteem because of punishments from his or her past. Letter C. A client exhibits the ability to assert himself or herself without anger or aggression. And letter D. A client morally feels guilty about wanting to have sexual relations outside of marriage. Ang sagot po natin dito is letter C. A client exhibits the ability to assert himself or herself without anger or aggression. The ego's main goal is to maintain harmony between id and the superego. The ability to assert oneself without aggression or anger is an example of healthy ego. Okay? Ang sagot po natin dito is letter C. Number 4. Growth involves resolution of critical tasks through the 8 stages of the life cycle. Is a concept of which therapeutic model? A. Interpersonal. B. Intrapersonal. C. Cognitive behavioral. And letter D. Psychoanalytic. Ang sagot po natin dito is letter B. Erickson's developmental theory assumes that intrapersonal growth involves resolution of critical tasks throughout 8 stages of the life cycle. Erickson's theory is classified as an intrapersonal theory. Again, Erickson's theory is classified as an intrapersonal theory. Therefore, our answer here is letter B. Okay, next question. Number 5. An advanced practice psychiatric nurse and a basic level nurse care is caring for families in the mental health clinic. Which of the following nursing interventions can be implemented solely by the advanced practice nurse? Advanced practice nurse po yung tinatanong. A. Case management. B. Psychotherapy. C. Counseling. D. Health teaching. Ang sagot po natin dito is letter B. Psychiatric clinical nurse specialist is trained to provide individual therapy and group therapy, and along with psychiatric nurse practitioners, have diagnostic privileges, prescriptive authority, and permission to engage in psychotherapy. Sa case management, pwede po kasing gawin ito ng basic level nurse like in assisting with data gathering, coordination, and implementation under supervision. And ganun din po sa counseling. Basic level nurses can provide supportive counseling under the guidance of advanced practice nurses. Sa health teaching naman, pwede din po ang basic level nurses. Okay? So our answer here is letter B, psychotherapy. Number 6. According to Maslow's hierarchy of needs, which situation exhibits the highest level of attainment? A. An individual avoids harm while maintaining comfort, order, and physical safety. B. An individual establishes meaningful interpersonal relationships and can identify himself or herself within a group. And letter C. An individual demonstrates an ability to discuss objectively all points of view and possesses a strong sense of ethics. And letter D. An individual desires accomplishments. Obviously, our answer here is letter C, demonstrating an ability to discuss objectively all points of view and possessing a strong sense of ethics relate to Maslow's description of self-actualization. Sige nga, i-review natin. Ano na nga ulit yung order ng Maslow's hierarchy of needs? Number 1 natin dyan is the physiologic needs like food and water. Okay? Number 2 is safety needs like security, stability, employment, and financial security. Number 3 naman is love and belongingness needs. Yan yung mga jowakels ninyo, family, friendships, and social connections or relationships. Number 4 naman is the self-esteem needs, which are the recognition, self-respect sa sarili natin to, and kabilang din dyan yung achievement and self-confidence. Lastly, yung number 5, ito naman yung nasa question, self-actualization, and this is realizing full potential, pursuing passions, personal growth, creativity, problem-solving, and spirituality. Again, ang tanong is the highest level of attainment, and our answer here is letter C, and this falls under self-actualization. Okay, number 7. The nurse is providing information to a client with the use of disulfiram antabuse for alcohol abuse. The nurse understands that this form of therapy works on what principle? A. Operant conditioning, B. Desensitization, letter C. Aversion therapy, and letter D. Gestalt therapy. Nasagutan na natin ito sa isang rasyon natin all about drugs at pwede ninyong tignan kasi collated questions yun on the common psychiatric medication. Okay? Our answer here is letter C. Aversion therapy po. Ang effect ng disulfiram is that it produces unpleasant reaction when combined with alcohol like nagkakaroon ng nausea and vomiting, headaches, dizziness, or lightheadedness. So, yung alcoholic individual, hindi na siya iinom dahil sa naramdaman niyang effect. Okay? Sana all na lang, di ba? Sana all hindi na umiinom. Charot. This form of therapy works on the principle of aversion therapy po. Sagot po, letter C, aversion therapy. Number 8. Which of the following about the pre-electroconvulsive therapy medications is considered as erroneous? A. Succinylcholine is a muscle relaxant. B. Atropine sulfate decreases secretion and should be given right after the treatment to decrease the risk of aspiration. C. Brevital is a barbiturate and is used to induce light coma. And letter D, none of the above. Erroneous daw, meaning mali or error. So, ang hahanapin natin dito is negative answer at ang sagot natin dito is letter B. Alcohol decreases secretion. Tama po yan, pero mali po na ibigay just right after the treatment. Binibigay po ang atropine sulfate intramuscularly approximately 30 minutes before the treatment. Okay? So, ang ating sagot dito is letter B. Number 9. Which is the goal of the orientation phase of the nurse-client relationship? Orientation phase po ang tinatanong. A. Explore self-perceptions. B. Evaluate goal attainment. C. Establish trust. And letter D. Promote change. Our answer here is letter C. The establishment of trust is the goal of the orientation phase. During this phase, a contract is established with the client. Huwag po natin kakalimutan. The establishment of trust is the goal of orientation phase. Yung letter A, explore self-perceptions. It occurs during the orientation phase but it is not primarily the goal. Okay? Yung letter B naman, evaluate goal attainment. Mali po ito kasi it occurs during the termination phase and not in the orientation phase. And yung letter D, mali din po because promoting change is a goal of working phase and not orientation. Okay? Again, our answer here for the goal of orientation phase is to establish trust. Letter C po ang ating sagot. I-review natin. Ano ba yung mga phases of nurse-client relationship? Number 1, it is the pre-orientation phase which is the initial contact. Number 2 naman is the orientation phase which is building trust and rapport. And number 3 is the working phase. It includes the assessment, planning, and interventions. And here, the nurse will promote change dun sa working phase. Okay? And lastly is the termination phase. It includes evaluation, discharge, and closure. Those are the phases of nurse-client relationships. And number 10. Let's go. The major cause of relapse and rehospitalization among clients is A. Non-accessibility of healthcare resources. B. Non-compliance to medication. C. Presence of multiple stressor. Letter D. Lack of support system. Ang sagot po natin dito is letter B. Non-compliance is often the primary cause of rehospitalization of those who suffer from schizophrenia or other affective disorders. Again, the major cause of relapse and rehospitalization is non-compliance to medication. Okay, number 11. A client has thoughts on threatening to murder his wife. Nurse Michael is in a predicament of whether to tell the wife about this or not. Nurse Michael's best thing to do is A. Alert immediately the proper authorities regarding the threat to safeguard the safety of the wife. Letter B. Tell the wife directly to be very extra careful as her life may be in danger. Letter C. Maintain patient confidentiality but remain vigilant on the actions of the client to protect the wife. And letter D. Weigh carefully the situation by viewing it as a dilemma between disclosing confidential information or warning appropriate authorities. Again, a client has thoughts on threatening to murder his wife. Ano daw ang best na gagawin ng nurse? Ang sagot po natin dito is letter B. Tell the wife directly to be very extra careful as her life may be in danger. Napapaisip tayo sa right to confidentiality ng patient, diba? Pero isang exception sa client's right to confidentiality is the duty to warn identifiable third parties of threats made by the clients. Even these threats were discussed during the therapist otherwise protected by privilege. Dapat magbigay ng warning yung nurse sa third party or yung wife ng patient on the possible danger. So our answer here is letter B. Next question, number 12. The chart of client with schizophrenia states that the client has echolalia. Echolalia is characterized as A. Speaking using words that rhyme, B. Including irrelevant details in conversation, C. Making up new words with new meanings, and letter D. Repeating words or phrases used by others. Ang sagot natin dito is letter D. Repeating words or phrases used by others. From the word itself, echo, meaning ine-echo niya yung sinasabi ng iba. Sa letter A, speaking using words that rhyme is what we call clang associations. Okay? Sa letter B naman, including irrelevant details in conversation, this is either circumstantiality or tangentiality. By the way, circumstantiality is talking excessively with unnecessary details before reaching the point, while tangentiality is speaking or replying with unrelated or off-topic information, making informations disjointed and hard to follow, indicating disorganized thinking. Yung letter C naman, making up new words with new meanings, it is called neologism. Okay? So our answer here is letter D for echolalia, repeating words or phrases used by others. Number 13. The overall priority goal of inpatient psychiatric treatment is A. Maintenance of stability in the community, B. Medication compliance, C. Better communication skills, and letter D. Stabilization and return to the community. Our answer here is letter D. Stabilization and return to the community. Tandaan po natin and huwag nating kakalimutan. The overall priority of inpatient psychiatric treatment is stabilization and return to the community. Ang maging stable yung patient at makakabalik siya sa community. Okay? Next question, number 14. An example of cognitive response to a mild level of anxiety is A. Increased concentration, B. Increased respiration, C. Feelings of horror or dread, letter D. Pacing the hall. Sagot po, our answer here is letter A, increased concentration, because mild level of anxiety is positive and adaptive. Mild anxiety prepares people for action. An increase in the ability to concentrate is a cognitive response to a mild level of anxiety. Di ba nga, pag malapit ng exam, ayan, mapapakonsentrate ka at mag-aaral ka talaga ng mabuti. Yan ang effect ng mild anxiety. Okay? Next question, number 15. A newly admitted client in the psychiatric ward tells the nurse that he cannot eat because his food has been poisoned. This statement indicates which of the following? A. Delusions of persecution, B. Paranoia, C. Hallucination, and D. Illusion. Ang sagot natin dito is letter B. Paranoia is described as extreme suspiciousness of others and their intentions. Parang nakakalito yung letter A, pero delusions of persecution are feelings that others intend harm or persecution. And the statement is not directly implying for persecution. And the best answer natin dito is paranoia because it is extreme suspiciousness of others and their intentions wherein hindi raw siya makakain kasi may poison daw yung pagkain. Okay? Our answer here is letter B. Number 16. A client's family is having a difficult time accepting the diagnosis of schizophrenia, and this has led to family conflict. Which nursing diagnosis reflects this problem? A. Interrupted family process, B. Impaired home maintenance, C. Social isolation, and D. Disturbed thought processes. Ang sagot po natin dito is letter A. Interrupted family process. The nursing diagnosis of interrupted family process is defined as a change in family relationships or functioning or both. This is reflected in the family's conflict related to an inability to accept the family member's diagnosis of schizophrenia. Again, ang sagot po natin dito is letter A. Interrupted family process po. Okay? Number 17. For clients who are taking neuroleptics, pseudoparkinsonism is a side effect that they should be observing for. This is caused by A. Acetylcholine overactivity. B. Hypersensitivity to anticholinergic medications. Letter C. Blockage in dopamine activity. And D. Destruction of basal ganglia cells. Ang sagot po natin dito is letter C. Blockage in dopamine activity. Schizophrenia is the main indication of taking neuroleptics, and schizophrenia is a mental disorder characterized by increased amount of dopamine in the brain. Thus, neuroleptics act to decrease the levels of dopamine. Again, sagot po natin dito is blockage in dopamine activity. Okay? Next question, number 18 na po. Which among the following is an atypical antipsychotic medication that has the most potential for a client to experience sedation, weight gain, and hypersalivation? A. Haloperidol. B. Clozapine. C. Chlorpromazine. And letter D. Risperidone. Sagot po? Our answer here is letter B. Clozapine, an atypical antipsychotic, and it has side effects including sedation, weight gain, and hypersalivation. Because of these side effects and the life-threatening effect of agranulocytosis, clozapine usually is used as a last resort after all other medications have been tried. Nagiging last resort na lang po ang gamot na to dahil sa kanyang side effects. Okay? Ang sagot natin dito is clozapine. Number 19, George has been receiving chlorpromazine, Thorazine, an antipsychotic to treat his psychosis. Which findings should alert the nurse that George is experiencing pseudo-Parkinsonism? Pseudo-Parkinsonism daw po. A. Tremors, cogwheeling, rigidity and masking face. B. Involuntary rolling of the eyes. C. Restlessness, difficulty sitting still and pacing. And letter D. Extremity and neck spasm, facial grimacing, and jerky movements. Ang sagot po natin dito is letter A. Yung mga symptoms ng pseudo-Parkinsonism ay halos parehas din sa Parkinson's disease, and included dito ang mask-like faces, cogwheel rigidity, tremor, bradycardia, and coarse pill rolling movements of the thumb and fingers while at rest. Very common po dito ang tremors. Huwag po nating kakalimutan. Okay, next question, number 20. The nurse is teaching the client with atypical depression about foods to avoid while taking phenelzinardil. Which of the following would the nurse include? Phenelzinardil po is Maui drug po, antidepressant. Which of the following would the nurse include daw po? A. Roasted chicken and cream cheese. B. Fresh fish and shells. C. Salami and yogurt. D. Hamburger and juice. Our answer here is letter C. Salami and yogurt because they are rich in tyramine. Sa letter A, mature cheese is rich in tyramine except cottage cheese and cream cheese, kaya okay lang po yung cream cheese. Okay? Tips sa mga tyramine-rich foods ay yung mga pagkaing tumatagal or yung mga preserved foods, yung mga fermented or yung mga old or mature foods. High in tyramine po ang mga yan. Okay? Sagot po natin dito is letter C. Next question, number 21. The police arrive at the emergency room with a client who has seriously lacerated both wrists. The initial nursing action is to A. Examine and treat the wound sites. B. Administer an anti-anxiety agent. C. Secure and record a detailed history. And letter D. Encourage and assist the client to ventilate feelings. Ang sagot po natin dito is letter A. The initial action is to assess and treat the self-inflicted injuries. Okay? Injuries from lacerated wrist can lead to life-threatening situations. So, kailangang assess and treat agad po. Yan ang sagot natin, letter A. Okay, next question, number 22. Which of the following symptoms of anorexia nervosa is physical in nature? Physical in nature daw po. A. Preoccupation with food. B. Dry, yellow skin. C. Perfectionism. And letter D. Frequent weighing. Physical po ang tinatanong. So, sagot po natin dito is letter B. Dry, yellow skin. It is a physical symptom of anorexia nervosa. This is due to the release of carotenes as fat stores are burned for energy. Again, our answer here is letter B. Physical symptom of anorexia nervosa is dry, yellow skin. Okay? Next question, number 23. The client with schizophrenia taking Thorazine calls the clinic and tells the nurse that her urine has become dark. The client has no other urinary symptoms. This indicates A. Medication toxicity. B. Unexpected side effect of the medication. C. To seek treatment for urinary tract infection. And letter D. To increase intake of acid ash foods and liquids. Our answer here is letter B. Normal lang po yung dark urine. The side effects of Thorazine is that the color of the urine may be darkened. And the client should be aware that this effect is harmless. Letter B po ang sagot natin. Sa Thorazine, normal lang po na dark yung urine. Okay? It's not harmful. Next question, number 24. The nurse notes that the client diagnosed with schizophrenia is moving her mouth, protruding her tongue, and grimacing as she watches television. The nurse determines that the client is experiencing, ang sagot po natin dito is letter C, tardive dyskinesia. It is an adverse reaction that can occur from antipsychotic medication. It is characterized by uncontrollable involuntary movements of the body and extremities, particularly the tongue. Common question po. Okay? Our answer here is letter C, tardive dyskinesia. Number 25. You are caring for a client who is sarcastic and critical and commonly expresses feelings that are opposite of what he is actually feeling. You know that this client is exhibiting which type of behavior? A, passive, B, aggressive, C, passive-aggressive, and D, assertive. Our answer here is letter C, passive-aggressive po. The passive-aggressive person is commonly sarcastic and critical and expresses feelings that are opposite of what he actually feels. He defends his rights through resistance. Dito sa passive, the person avoids direct expression of needs and feelings, prioritizes others' needs over own. The person also is non-assertive or fails to express opinions or needs. Yan po ang passive. Sa aggressive naman, the person expresses needs and feelings forcefully. Also prioritizes own needs over others. The person is also confrontational or attacking or blaming others. And sa assertive naman, ito yung magandang communication wherein the person is clearly expressing his or her needs. Respectful din siya, considered others' needs and feelings. Sana assertive po tayong lahat. Okay? Okay, number 26. The most common mental disorder among elderly patients is A, anxiety disorder, B, schizophrenia, C, depression, and letter D, paranoid thinking. Ano daw ang most common mental disorder among elderly patient? Ang sagot po natin dito is letter C, depression. Depression is the most common psychiatric disorder in older adults, but it is not a natural result of aging. Again, the most common psychiatric disorder in older adults is depression. Depression po, okay? Older adults, depression. Number 27. Ali, an adolescent with borderline personality disorders, is hospitalized with suicidal ideation and self-mutilation. A goal which is both therapeutic and realistic for this client is A, the client will remain in her room when feeling overwhelmed by sadness. B, the client will seek out a staff member to verbalize feelings of anger and sadness. And letter C, the client will request medication when feeling loss of emotional control. And letter D, the client will leave group activities to pace when feeling anxious. Our answer here is letter B. Verbalizing feelings of anger and sadness to staff members is an appropriate therapeutic goal for the client with risk of self-directed violence. Okay po. Sagot po natin is letter B. Obviously, letter B po sa ating sagot. Number 28. You are taking a history from Belle, a woman diagnosed with bulimia nervosa and suspects that she may also have a substance abuse disorder. Which illicit drug should you ask Belle if she has used? Ang sagot po natin dito is letter B, amphetamines po. Common question po ito, clients with bulimia nervosa will commonly use amphetamines as an additional way to control weight. Amphetamines. Huwag natin kakalimutan, sagot natin dito is letter B, amphetamines po. Number 29. The nurse is monitoring a client who abuses alcohol for signs of alcohol withdrawal. Which of the following would alert the nurse to the potential for withdrawal delirium? A, hypotension, ataxia, hunger. B, hypertension, changes in level of consciousness, hallucinations. Letter C, stupor, agitation, muscular rigidity. And letter G, hypotension, coarse hand tremors, agitation. Sagot po, our answer here is letter B, hypertension, changes in level of consciousness, hallucinations. Some of the symptoms associated with withdrawal delirium, typically anxiety, insomnia, anorexia, hypertension, disorientation, hallucinations, and changes in level of consciousness, agitation, fever, and delusion. Sagot po natin dito is letter B po. Okay? Hypertension, changes in level of consciousness, hallucinations. Okay? Next question, number 30. Mrs. Lopez was diagnosed with obsessive-compulsive disorder and has a habit of washing and scrubbing her hands for so many hours every day. The most likely reason she exhibits these behaviors is that they A, reduce the probability of infection, B, relieve her anxiety, C, give her a feeling of control over her life, and letter D, increase her self-concept. This is a very common question po. Again, this is very common question. And our answer here is letter B, relieve her anxiety. Compulsions, unwanted, repetitive behavior patterns, or mental acts like praying, counting, repeating words silently, those are intended to reduce anxiety for the patient. It is not to provide pleasure or gratification. Okay? To reduce anxiety of the patient for compulsive disorder. Number 31. A client with diagnosis of major depression recurrent with psychotic features is admitted to the mental health unit. To create a safe environment for the client, the nurse most important devises a plan of care that deals specifically with clients: A. Disturbed thought processes, B. Self-care deficit, C. Imbalanced nutrition, D. Deficient knowledge. Again, a client with diagnosis of major depression recurrent with psychotic features is admitted to the mental health unit. To create a safe environment for the client, the nurse most importantly devises a plan of care that deals specifically with the client's: A. Disturbed thought processes, B. Self-care deficit, C. Imbalanced nutrition, and letter D. Deficient knowledge. Ang sagot po natin dito is letter A. Disturbed thought processes generally indicate a state of increased anxiety in which hallucinations and delusions prevail. Sagot po natin dito is letter A. Okay, our answer here is letter A. Okay, number 32. A client is prescribed sertraline, Zoloft, a selective serotonin uptake inhibitor. Which adverse effect about this drug should the nurse include? A. Granulocytosis, B. Sleep disturbance, C. Seizures, D. Pseudoparkinsonism. Again, na-discuss na natin to sa latest rationalization natin at pwede po ninyong panoorin yon kasi collated questions po yon sa mga medications on psychiatric nursing. Okay po, sana makatulong din yun sa inyo. At ang sagot natin dito is letter B, is sleep disturbance. A client taking sertraline may experience sleep disturbance. Serotonin plays a part in a sleep-wake cycle, and if there is change in the level of serotonin because of the SSRI medication, specifically sertraline, then of course, affected din po ang sleep pattern natin. Magkakaroon ng sleep disturbances. Yung granulocytosis and seizures are adverse effects of clozapine po. Pseudoparkinsonism is an adverse effect of haloperidol. Okay? So, ang sagot natin dito is letter B, is sleep disturbance for serotonin uptake inhibitor, sertraline. Number 33. The abuser and the abused shares which of the following? A. Low self-esteem, B. Dependency, C. Unaware of the abuse, and letter D. Alcoholics. Again, common question po. Our answer here is letter A. Typically, the abuser has strong feelings of inadequacy and low self-esteem. The abused also often suffers from low self-esteem. Okay? Ang sagot po natin dito is letter A, low self-esteem. Number 34. According to the biochemical theory of addiction, people who abuse drugs have stimulation of which of the following? A. Dopamine, B. Norepinephrine, C. Serotonin, and letter D. Acetylcholine. Ang sagot po natin dito is letter A, dopamine po. The overstimulation of the brain's reward system, which rewards our natural behaviors, produces the euphoric effects and sought by people who abuse drugs and teaches them to repeat the behavior. Nakaka-addict po. Okay? Again, our answer here is letter A, dopamine. Dopamine po. Number 35. The community members assisted in asking respondents to be surveyed who are at most risk to substance abuse, and this would be the most at risk to substance abuse daw po. A. Adults, B. Adolescents, C. Older children, and letter D. Elderly. Sagot po natin dito is letter B. Adolescent impulsivity and novelty seeking as a transitional trait behavior may advantageously promote learning, drives for adaptation roles to adult roles, and may also confer greater vulnerability to the addictive effects of drugs. Okay? Adolescent po. Again, our answer here is adolescent. Number 36. What contributing factor puts a client at risk for alcoholism according to the biological theory? A. The client is a child of an alcoholic parent. B. The client is highly self-critical and has unconscious anxiety. C. The client is fixated in the oral phase. And letter D. The client is unable to relax or defer gratification. Biological theory po ang tinatanong, so our answer here is letter A. Genetic theory falls under category of biological theory. A. Hereditary factors involved in the development of substance abuse disorders, especially alcoholism. Again, sagot po natin dito is letter A. A client is child of an alcoholic parent. Okay, next question, number 37. Teenagers who join fraternities and gangs are high-risk groups for drug abuse. Which psychosocial need is best met through peer counseling? Again, teenagers who join fraternities and gangs are high-risk groups for drug use. Which psychosocial need is best met through peer counseling? A. Recognition. B. Belonging. C. Self-esteem. D. Security. Our answer here is letter B. Belonging. Counseling groups which provide peer support and modeling can give adolescents a sense of belonging and can help them to separate and achieve independence from adults. Okay? Sagot po natin dito is letter B. Belonging po. Number 38. The primary goal of psychosocial treatment for families of discharged psychiatric patient is A. Provide gainful employment. B. Ameliorate poverty and social ills in the community. C. Enhance coping efforts and reduce stressful life events. And letter D. Provide education on medication management. Ang sagot po natin dito is letter C. Enhance coping efforts and reduce stressful life events. Because the primary goal of psychotherapy is helping people cope more adaptively with internal and external sources. We aim to decrease suffering and maximize functioning in ways important for the person. Okay? Ang sagot po natin dito is letter C. Another common question po. Number 39. During the nurse-patient interaction, Alan refuses to talk and demands that Nurse Aya stay far away from him because he is reminded of his parents who were always very strict to him. Alan is demonstrating A. Resistance, B. Counter-transference, C. Transference, and letter D. Boundary violation. Ang sagot po natin dito is letter C. Transference. Occurs when the client unconsciously attributes or transfers to the nurse's feelings and behavioral predispositions formed toward a person from his or her past. Ano ba kasi ang pinagkaiba ng transference and counter-transference? Sa transference, ang usapan dito is tungkol sa patient wherein the patient transfers to the nurse's feelings and behavioral predispositions formed toward a person from his or her past. Sa counter-transference naman is yung nurse. It is the nurse's unconscious emotional response to the client, influenced by their own experiences, biases, or unresolved issues. Yan lang po ang diferensya. Okay? Number 40. Strategies to address the inactivity of depressed patients include A. Assisting them to do goal setting, B. Delving into unconscious fears, C. Encouraging them to interact with other patients, and letter D. Exploring the patient's inner conflicts. Ang sagot po natin dito is letter A. Assisting them to do goal setting. Setting goals with the client promotes performance of ADLs. Presence of psychomotor retardation may hinder the client to perform ADLs. Ang sagot po natin dito is letter A. Assisting them to do goal setting. Okay? Number 41. Tapering of barbiturates as part of the detoxification is done to A. Avoid hypoglycemia, B. Manage hallucinations, C. Prevent coma or death, and letter D. Eliminate the possibility of drug resistance. Our answer here is letter C. To prevent coma and death. Tapering or administering decreasing doses of medication is essential with barbiturates to prevent coma and death that will occur if the drug is stopped abruptly. Again, our answer here is letter C. Tapering is to prevent coma or death for barbiturates. Number 42. Antonio, a veteran of the Philippine Army, is diagnosed with PTSD. He says to the nurse, "I can't figure out why God took my body instead of me." From this statement, the nurse assesses which of the following in the client. A. Repressed anger, B. Intrusive thoughts, C. Survivor's guilt, and letter D. Spiritual distress. Our answer here is letter C. Survivor's guilt is an expression of the person who feels the guilt who has not been affected or hit by the trauma, but there was a fair probability that he or she could have been the victim. Again, our answer here is survivor's guilt po. Okay? Number 43. Andrew, a good-looking patient of Argentine descent, is exhibiting sexually provocative behaviors towards the nurse. The best intervention for the nurse to do is to A. Tell client to stop what he is doing. B. Have the client play cards with other clients. C. Encourage client to stay in his room and reflect on his behavior. And letter D. Ignore his behavior. Our answer here is letter A. Tell client to stop what he is doing. Patigilin mo na agad. Limit setting is first instituted to remind them that these actions are inappropriate. Okay? Our answer here is letter A. Number 44. You are planning activities for Dora, a client who has bipolar disorder with aggressive social behavior. An activity that would be appropriate for Dora is A. Chess, B. Writing, C. Ping pong, D. Basketball. Our answer here is letter B. Writing po. Okay? Solitary activities that require a short attention span with mild physical exertion are the most appropriate activities for a client who is exhibiting aggressive behavior. Again, solitary activities that require a short attention span with mild physical exertion are the most appropriate activities for a client who is exhibiting aggressive behavior. Solitary activities are tasks or hobbies done independently without the presence or direct interaction of others. Examples include reading, writing, and puzzles. Yan po yung mga pinaka-best na activities for clients who is exhibiting aggressive behavior, solitary activities. Number 45. A client with schizophrenia has been started on medication therapy with clozapine. A nurse assesses the results of which laboratory study to monitor for adverse effects from this medication? A. Platelet count, B. White blood cell count, C. Blood glucose level, and letter D. Liver function studies. This is very common questions po. Because of the life-threatening side effects of clozapine, which is the granulocytosis, we need to monitor for the white blood cell count. Therefore, our answer here is letter B. Tinitigil po ang treatment of clozapine if the white blood cell count decreases to less than 300 cell per cubic meter pa. Okay? Next question, number 46. A client taking lithium carbonate reports vomiting, abdominal pain, diarrhea, blurred vision, tinnitus, and tremors. The lithium level is 2.5 milliequivalent per liter. The nurse interprets this level as letter A. Toxic na po yan. Our answer here is letter A. Toxic na po yung ganyang level. Remember, the normal lithium level are 0.6 to 1.2 mEq per liter. Lithium toxicity begins to appear at level of 1.5 to 2 mEq per liter. Yung 2.5 mEq per liter is very high level na po. Therefore, our answer is letter A. Toxic. Toxic na toxic. Okay. Number 47. Lola Basyang, an elderly client who experiences nighttime confusion, wanders from her room into the room of another client. The nurse can best help decrease the client's confusion by... Our answer here is letter A. Leaving a night light on during the evening and night shifts. Leaving a night light on during the evening and night shifts helps the client remain oriented to the environment and fosters independence. Again, our answer here is letter A. Okay, number 48. You are caring for a client who reports feeling estranged and separated from himself. You could describe the symptoms as A. Intoxication, B. Depersonalization, C. Existentialism, and letter D. Anti-motivational syndrome. Ang sagot po natin dito is letter B. Depersonalization. Depersonalization is characterized by feeling of separateness from oneself. Okay? So, yan po ang ating sagot, letter B. Joycel, a 15-year-old girl, spends time putting on makeup and straightening her hair. She loves to shop dresses and has a great deal of interest in culinary arts. This scenario shows that Joycel is already able to establish her A. Gender role, B. Gender identity, C. Sexual identity, and letter D. All of the above. Ang sagot po natin dito is letter A. Gender role po. It refers to the many behaviors such as wearing dresses and makeup versus wearing pants and neckties that identify an individual as male or female. It is not as unchangeable as gender identity and usually tends to fluctuate during the life course due to its changes in beliefs, attitudes, and social mores. Okay? Gender role po. Number 50. A nurse is caring for a client who was accused of voyeurism by his neighbors. Which term most appropriately describes such behavior? A. Dissociative fague, B. Paraphilia, C. Depersonalization disorder, and letter D. Gender identity disorder. Ang sagot po natin dito is paraphilia. Letter B. It is a general diagnosis that encompasses such disorders as exhibitionism, fetishism, pedophilia, and voyeurism. Yung exhibitionism, ito yung pinapakita mo sa public yung mga pribadong mga ano mo. Alam nyo na. Hindi ko nasasabihin, baka mag-email na naman si YouTube sa atin. Okay? Next is yung fetishism. Ayoko na. I-search nyo na lang. Baka mag-notice na naman si YouTube sa atin. Sige guys. Basta this is under paraphilias. I will drop na lang yung mga review materials sa baba. Baka makatulong. And I thank you. Okay? This is the last slide and the last question. And thank you so much guys for watching and I hope this helps. God bless us all.